Hello everyone, my name is Nana and welcome to Nana's platform. Today I'm going to talk to you about hemoglobin A1C test versus finger pricking tests. And these tests are used to determine the glucose level in the blood and in the plasma, in the red blood cells and the plasma for people with diabetes. So I'll start by explaining red blood cell. Red blood cell has a biconcave shape. So these are biconcave shape normal red blood cells, and it has an expiry date of between 90 and 120 days. Average of between 90 and 120 days. So what this test does, that's the HbA1C test, is it actually identify the level of glucose in the red blood cell itself. So if you take let's come here. If you draw a blood sample from a patient, actually the blood is taken specifically from the medial cubital vein in the cubital fossa in the arm. Right, this is where you take the blood sample for the HbA1C test. So if you plot a graph of concentration in millimole per liter over time or days, so this is 120 days, that's the lifespan of the red blood cell. So what the test does is it takes the average within that 120 days, or some of them 90 days, 3 months, and it takes the average of it. It takes the average of it and gives you the average reading. But with the plasma, it determines the blood glucose level. When it's any sample that you take that's a plasma, you normally prick the finger. Let's say you prick the middle finger here. You do get exactly, when you take it, let's say in day 30, you do get day 30 reading. It's current reading. It does not consider for the duration of the duration of let's say no more than the day that you take the test. It just gives you the current reading. So if, for example, if you take it on, let's say day 30, you get like reading of about 3. If you take it let's say day 60, you do get a reading of about almost 8. You take it here day 90, you do get reading about 5.1. And so on and so forth. So this plasma reading is just exactly the current reading. That's what you get on the day of on the day that you prick the finger for the test. It doesn't take into consideration the average, but however, the red blood cell and that's the HbA1C test takes the whole average. So it's a better test. The HbA1C is a better test to measure the blood glucose level for people with diabetes, and because it takes into consideration for the whole lifespan of the red blood cell, that's 120, between 90 and 120 days, and gives you the average. So however, it's not an effective test for people with sickle cell disease, sickle cell anemia, because for them they don't have the normal red blood cell shape. The shape is more sickle shape, so the red blood cell do not last for 120 days. It gets destroyed more quicker, so you can't rely on the HbA1C test for them. You just have to make do with the plasma test. Folks, that's it for now. That's the main difference between the HbA1C test and the finger pricking test for people with diabetes. Thank you very much for watching. Thanks.